Pooja.
Hi.
Welcome to Catalyzing Change Week. This year's Catalyzing Change Week is about solutions from the front lines by social innovators.
In 2022, Catalyst 2030 concentrated its efforts on bringing proximate leaders and frontline solutions to the forefront. Collaborations led by members from the Global South produced groundbreaking reports on climate and transforming education, with an emphasis on offering local solutions. We continued our mission to create an enabling environment for social entrepreneurs to flourish by initiating a letter to donors, signed by more than 1,200 social entrepreneurs and innovators. The Catalyst 2030 awards ceremony was spectacular, and the awards themselves welcomed by the private sector, governments, bio multilaterals and donors.
Catalyst 2030 as a movement is disruptive.
One of the best things I think that's come out of Catalyst 2030 so far is incredible collaboration across the ecosystem that just didn't exist before Catalyst came into being.
The thing I love most about Catalyst is that it's an open movement for social entrepreneurs around the world.
I'd encourage anyone who's looking to be more connected with their local communities around social development goals to come along to Catalyzing Change Week.
Welcome to Catalyzing Change Week.
So welcome everyone. Over to you, Olivia.
Thank you, Lana. Hi, everybody. Welcome to the session. I'm just gonna maybe give it a minute more while we all have everyone joining before we begin. But meanwhile, maybe I'll just share a couple simple housekeeping rules before we get started. Around here. So yeah, welcome to the session today. Thank you for just a couple things. If you are able to keep your camera on, that would be great. What would be helpful is in your caption, if you can include your name and maybe the organization you're representing to help us have a sense of who is in the room with us today. Also, if there are any questions that you'd like to ask during the session, feel free to put them down in the chat as we go, and we'll invite you to bring them into the conversation or respond directly in the chat as we move along. So to get us started, welcome to the environmental surveillance session, the future of health equity in Asian cities. I am Alifia Mutahar, and I, along with my colleague Rohan, will be facilitating today's session. We are from Quicksand, which is a design research and social innovation studio based in India. Today's session is hosted by the Indian Alliance for Public Health Preparedness, which is anchored by Precision Health Platform and facilitated by Quicksand. We will be sharing more about both these platforms with you shortly. For today's event, we will briefly introduce, let me just talk you through this. We will briefly introduce the Alliance itself, followed by a showcase of environmental surveillance initiatives that are happening across Asian cities at this point. In general, the surveillance movement has been significant in the pandemic and also in responding to COVID itself. But having moved past the critical stage of the pandemic, how are we now scaling up, and what are the benefits? What have we learned from the pandemic, and how are we now scaling this to other infectious diseases in Asia itself? And where are we at in this model? And through this conversation, what we'd like to understand is how can we learn from what the pandemic taught us, and then also scale this in mainstreaming this across the cities with different models that have been effective. So we'll start off with a showcase with 3 significant speakers who are working in the space across Asia. One is Mr. Praveen Kandasamy, who represents PATH South Asia. He'll be bringing in a perspective of working in the region itself, followed by Dr. Varsha Sridhar, who represents Molecular Solutions based in India, and followed by Dr. Rizaul Hassan of ICDDR in Bangladesh. We'll be introducing them in more depth later on in the session. And this will be followed by a panel conversation facilitated by Dr. Pooja, who is from Crypto Relief Fund. And through the panel conversation, we'll be highlighting aspects of advocacy and partnership building in scaling environmental surveillance across this region in general. To start us off, I'm going to invite Spriha Atre, who is the Relationships Manager at Precision Health, to introduce us to the work they've been doing and talk us through what the Alliance is also currently focusing on.
Sure. Thank you, Alifia. A very good afternoon to everyone. And thank you for joining us on this wonderful session. We're very excited to host this at the Indian Alliance for Public Health Preparedness, which is an initiative of Precision Health that is one of the core initiatives at Swasti, the public health organization that I work at. We started Precision Health 2 years ago when the peak of the second wave of COVID was kind of engulfing India. And at that time, we wanted to have a partnership-driven, a people-centric approach, which could help us get very rapid action, real-time action for how can we kind of address the pressing challenges that COVID threw on us at the time. And so we started this initiative with just a focus on ensuring that how can we address health equity, but also cost effectiveness, which is when we stumble upon environmental surveillance, which is the science of a low cost, low tech public health surveillance tool that when we started in testing for in Bangalore in 2021, it helped us provide early warning signals, which were translated to the local government of Bangalore, the BBMP, and helped them address quick policy actions through that. So while we started with a citywide COVID wastewater surveillance in Bangalore, we have since then been able to scale the initiative up to 4 other cities of Jodhpur, Lucknow, Trivandrum, and Trichy. And we hope that we are able to reach 20 more cities in the next 3 years, helping local city governments be better prepared to tackle disease outbreaks, emergencies of like a pandemic consequence and other climate health related crises. We also did a pilot study to test the presence of AMR genes in wastewater. And in Bangalore, we conducted an entire integrated disease surveillance that covered SARS-CoV-2. But beyond that, we moved to testing for other pathogens such as influenza A and B, H1N1, and monkeypox last year. I'll talk about the Indian Alliance for Public Health Preparedness in a bit, but I just wanted to go on the next slide and talk about how our focus, the Precision Health's focus, is entirely on urban resilience and health equity through the science of environmental surveillance. How can we support the existing public health systems to better prepare for health crisis? And how can we use a multi-stakeholder, a multi-partnership approach to be able to address those pressing health issues using research, but also advocacy and risk communication, so integral to address any kind of health crisis. In the next slide, we want to share that the Precision Health program, while started at the peak of COVID waves, and we were addressing disease outbreaks of infectious diseases and other kinds that I just mentioned, we want to now expand to climate-mediated health risks for vulnerable communities. At Precision Health Platform 2.0, we hope that geospatial intelligence, along with participatory community-driven health data, can help address the impact of climate change on those to whom it particularly matters. These vulnerable communities could be expecting mothers or the elderly or people with comorbidities, communities that Swasti has worked with for the last 2 decades. Again, at Precision Health, we believe that each of our partners, whether they are data scientists or geospatial data intelligence companies, eminent academicians, laboratories, research institutions, or local municipal agencies, associations of clinicians, or public health agencies, each of them domain experts in their own fields, need to come together for evidence-based health communication so that ultimately it's the communities, the vulnerable communities that gain from. With that, I'm happy to introduce the Indian Alliance for Public Health Preparedness. Our work focuses on advocacy, where we speak to apex government bodies to talk to them about how they can strengthen the existing public health systems across city and state governments. We want to focus on mainstreaming environmental surveillance across 25 cities in India by 2025. And this we do by bringing in diverse stakeholders for advocacy, research, and knowledge sharing, all with the purpose for addressing urban resilience and health equity through environmental surveillance. In the next slide, I am pleased to share about the Alliance members who are eminent scholars, come from leading philanthropic organizations, many of them leading scientists, researchers, academicians, bureaucrats, and ex-bureaucrats, all who've come together to help advocate and convince apex government bodies to be better prepared to use environmental surveillance to tackle public health emergencies. I'm very pleased to share that 2 of our Alliance members are on the panel to present before you today. And without further ado, I'll request Alifia to introduce our first speaker. Thank you.
Thank you, Spriha. So for today's showcase, we have 3 speakers who we're very pleased to have joining today's event. First, and they bring in different perspectives to help us understand where we are at currently with environmental surveillance as a whole, or as a tool that's being used at scale in each of our regions. So one perspective we'll get is broadly from Mr. Praveen around the whole South Asian landscape itself, while Dr. Varsha will speak about more specifically the work that's been happening in Bangalore city in India. And Dr. Rezaul will bring in a perspective that speaks about more broadly around Bangladesh and how they have been engaging with government and scaling this up with the national health system itself. And this is all to understand from the work that we have also been doing and through the Alliance and through Precision Health Platform, what are strategies and starting points for us to build forward in mainstreaming environmental surveillance as a whole. So starting with Mr. Praveen. Mr. Praveen Kandasamy is a project lead for laboratory strengthening, AMR, and One Health with PATH South Asia Hub for over the past 10 years. He is a trained and experienced microbiologist and is responsible for liaising with national, state, and international stakeholders for laboratory strengthening procedures and protocols. He has supported countries like Sri Lanka, Nepal, Vietnam, South Africa in developing protocols for tuberculosis diagnosis and implementing AMR projects. He is also involved in developing the protocols for surge laboratory testing for COVID-19 in India, and has helped establish the whole genomic sequencing lab in 5 states across India. So with that, please join us, Mr. Praveen, with showcasing the work that you have been doing.
Thank you. Thanks to the organizers, and good afternoon, everyone, those who have joined the call. So I will quickly get started with this call. I'm going to briefly talk about on the work which we have done at PATH. So maybe you can move to the next slide, please. So this slide is largely about all the environmental surveillance project which we have been doing since 2011. The gray shaded ones, the top 6 ones, if you can see, those are the ones which we have already completed, and the bottom 3 are the ones which are still ongoing. So conventionally, if you see, it covers a wide range of countries, and then these few projects were based on typhoid environmental surveillance, polio surveillance, and during the pandemic, we got to work even on the SARS-CoV-2 and flu also. And at present, we are actively working in Pakistan, Afghanistan, and Yemen to look at the polio environmental surveillance and looking at a solution called bag-mediated filtration system, which is very unique as compared to the conventional method of doing the environmental surveillance. Next slide, please. So this is just to give you a geographic map, a representation of all the projects which we are doing across the world. And then if you can see, the shaded ones are the ones where we have sampling methodologies, the technical assistance for ES field deployment, the costing and cost effectiveness analysis also we have done, and it has also been published. So data dissemination and visualization, that is very critical, because many times the environmental surveillance have been done, but then the data dissemination and visualization to various stakeholders is very essential to bring them an understanding of what has been the reason and how these environmental surveillances are helping them in identifying the potential threats. Landscaping of ES activities in Africa, and development and QC standards for ES. That is very important, because doing the right sampling and processing the right samples for doing the surveillance is very critical. So that we have been doing. So moving to next slide, please. So I will briefly touch upon the recent project on COVID environmental surveillance project. So the project aims were to detect and quantify the SARS-CoV-2 in the wastewater samples, and then you can see we did it in these countries, which includes Malawi, Nepal, Pakistan, Indonesia, and Brazil. And methodology to determine for determination of SARS-CoV-2 present and trends, including variants detection and relative abundance. Waterpathogens.org, where you can go through and look at various environmental surveillance data, estimate the incremental cost and cost effectiveness of a wastewater surveillance program for SARS-CoV-2 in various contexts. So next slide, please. So this is just to show how these study sites have been involved in collecting samples from the river, from the passive sampling, from the manholes near the residential areas, and also from various high-rise societies or hotels where people do commute from various parts of the world. And then how the lab activities, the sample preparations have been taken place. And lastly, how these samples being collected are processed in a laboratory using genomic sequencing. And then conventionally, Arctic protocols were the predominant protocols being used for SARS-CoV-2 is also being used for the ES surveillance as well. Next slide, please. So coming to the costing and cost effectiveness analysis of ES for SARS-CoV-2 in Malawi and Nepal. So you can also browse through the literature. So largely the consumables and the human resource costs have the largest share of the cost. The cost per person in the catchment area per year range from $0.07 to $0.13 in Kathmandu. And if you look at the down table, you can see the difference between the surveillance without an environmental surveillance and with an environmental surveillance. Nearly around $10,000 plus difference can be estimated. But this was on a project mode, but if it can become a conventional way to be rolled out in a national program, typically the cost will then come down. And generally during the pandemic period, the supply chain also were on a higher side for making arrangements. So I think those costs also we need to keep into consideration, and that cost will also come down gradually over a period of time. Next slide, please. So this is just to show, of course, everyone here might know about the genomic surveillance and how ES also is typically fall under this umbrella where genomic surveillance is being used. But then beyond even knowing what pathogens we are talking about, what data we get is also going to help you identify the risk assessments of epidemic potential pathogens, and also it helps you to support the development of vaccine therapeutics, diagnostic assays, and decision on informed public health policies. So I think generally when we have seen people doing ES, they only focus on identifying these pathogens, but as a byproduct or as a direct support from the data, you can even look at various other aspects of how you can even use these data or information or the sequence to develop a product, maybe a diagnostic products, which today might not be even existing, could be of help. And then this diagram down below is just to show, and what is more critical here is in the three circles, the One Health circle, which we talk about. So that intersection between the environment, human, and health is the typical part where no one knows what exists there, and that's where it is very essential that most of the surveillance activities needs to be focused on, and that's where largely more number of unknown pathogens could be as potential as an endemic or even epidemic, as well as potential for even a pandemic exists. And then on the right side arrows is on the samples and the metadata, and then how these sequencing data can be analyzed and can be disseminated to a larger stakeholders at national and international level for a better understanding. Next slide, please. So at PATH, we have conceptualized this vision of having an integrated diagnostics and surveillance system. So at the center, if you can see the IPHL, so it is called Integrated Public Health Laboratory. So on the top right side, also you can see Block Public Health Unit. So IPHL is typically going to be based out of a district hospital. Block Public Health Unit are going to be at the community health centers. So what we are trying to do is whatever the other facilities, may be public health centers or even health and wellness centers, are there at a community level, and how we can engage with these hierarchy facilities in an active mode where every day, whatever the samples being collected may be originated from human side, even if it is coming from even a livestock, from a vector, food environment. So how we can ensure that these samples are collected in a collaborated manner, and how these samples can be sent to the reference laboratory in their respective vertical programs, so that every day the processing or understanding on what sort of disease or infections are prevalent is very critical. And then we are pretty much doing this activity in 10 states. So last year we did cover 10 states. So this year we are in discussions with the stakeholders at a state level to allow piloting these sort of integration, because this is how you are going to have a continuous monitoring of your surveillance system. And then environment surveillance is very much needed in these sort of states, and of course pan India we need to do, but then we are going to start as a pilot mode. Next slide, please. So what are the other planning? So what we are trying to do is to create an ecosystem to promote wastewater surveillance for priority disease and health priorities, and which also include enhance state health department capacities to undertake wastewater surveillance. So what we have been doing is we conventionally engage with the public health facilities, and then last year during the pandemic, we setting up sequencing that based out of the getting themselves prepared for carrying out surveillance on their own. But at the same time, they are also in discussions with the apex body, the reference laboratory at the regional level, to guide them on various surveillance parts. Promote local manufacturing of kit reagent. That is very essential, because many times importing of kits and all this are very expensive affairs. So that way, through CCAMP, I think there was an initiative where a large number of Make in India kits were encouraged to come up and validate their products. So that way we are more than happy to even looking at those solutions. Partnering with like-minded organizations and experts to develop, implement innovative seaway surveillance system, that is very much open for us. So we believe in partnership, and partnership ends up getting into a better way of collaborated way of working in the field. So we are also piloting the use of whole genomic sequencing for surveillance of AMR and One Health. So again, we have been in discussions with 3 states, which also includes Karnataka, and one in the Northeast, Mizoram, and one at Rajasthan. So leverage the existing network of genome sequencing laboratory. So INSOCOG, which was established during the COVID time. So what we are trying to do is from the previous slide where we have shown the map. So we are trying to engage the district as well as the block public health unit, so that any unknown pathogen which may have come up in those locations, the samples can be sent to the INSOCOG, so that they can also process and see that to what extent this could be a potential risk. Developing strategies, the existing artificial lab, so that is very much critical, because the country today may have more than 10,000 labs, and the number of RT-PCR equipments may range between 25,000 to 30,000 units sitting in district hospitals and various healthcare facilities. But then beyond COVID, the government is still figuring out what to be done. So what we are trying to do is how can we even come up with a mechanism where these RT-PCR labs could also be used for carrying not just the routine diagnostic test, but also to be used for the surveillance within the healthcare facility or any pilot mode from where these samples can be collected and tested. And lastly, PATH working with International Technical Advisory Group to define essential for QA/QC controls for criteria for implementing environmental surveillance for multiple pathogens in LMICs. So I think this is my last slide, and this is about the global partners. Thanks to the donors and the partners with whom we have been working at various countries, and then thanks to each one of them, not just by providing funding, but also to provide their technical skill sets along with our global experts who are already there with PATH. So I think this partnership has really come up well, and then many countries we are able to even advocate for considering environmental surveillance as a part of their routine program and not to consider it just as a project mode. So because unless the government takes up the ownership, the environmental surveillance is still going to be a dream for any countries to have it. So that advocacy is going on, and many countries have taken it forward, and we are happy that government also has understood the need to have this environmental surveillance. Next slide, please. Yeah, I think that's it. Thanks to everyone for listening patiently, and then I will close my.
Thank you, Mr. Praveen. Thank you for sharing that quick landscape insights into what's happening. If there are any questions for Mr. Praveen, please bring them into the chat and we can respond there. Next, I'd like to invite Dr. Varsha Sridhar, who is from Molecular Solutions Care and Health in India. Dr. Varsha is joining us from a car, like a moving vehicle at the moment, so please bear with that. Dr. Varsha is a public health practitioner and molecular biologist with a focus on point-of-care diagnostics. She is the Chief Enabling Officer and co-founder of Molecular Solutions Care Health, and she has a keen interest in coalition building, is a crusader for respectful, non-judgmental, empathetic, and holistic healthcare. Since 2020, the focus of her lab has expanded to disease monitoring and prediction using data from environmental, clinical, and community sources. Dr. Varsha is also a member of the Indian Alliance for Public Health Preparedness. And with that, over to you, Dr. Varsha.
Thank you so much, Alethea, and apologies in advance if there are any issues with my internet. I have stopped at a place which I think is good.
We're losing you a little bit, Dr.
Next slide,
Varsha,
please.
but we can hear you.
Hi, can you hear me?
We can hear you. We're losing you a little
Okay,
bit,
great.
but please carry on. Yeah.
Yeah, I'm going to turn off my video for a second, right? Okay, great. So these are my objectives for today. I'm going to provide an overview of Bangalore's environmental surveillance scene and learnings. I'm going to highlight an intercity context of Bangalore and its wastewater, and discuss how to enhance health equity while mitigating risks through environmental surveillance. Let's move on. Next slide. Let's look at the first one first. This issue of using environmental manipulation for disease control or surveillance is not new. This is a picture from 1914, and this is colonial Bangalore, where they realized that they could control cholera outbreaks in the. They, however, did not do that for the local Indian outposts, so the cholera continued in those things, in those areas. Next slide, please. I'm not going to go into too much of detail. Basically, to let you know that Bangalore is special in multiple different contexts, and one of the ways in which it's special is that it has a very, very strong startup, civil society, and a academic research background. So currently there are actually 4 groups all doing environmental surveillance in Bangalore with the support of the local government. Angela over here there's a little red circle that you see. Angela and Uma, the one to her left, were the first couple of people in Bangalore who kind of independently started two environmental surveillance projects in 2020. Angela's group, which kind of is headed by Swasti, and then the Precision, which became the Precision Health Coalition, we started doing it, started surveilling open drains, and Uma's group started surveilling sewage treatment plants. And in about 2021, we merged everything, and this actually became one of the biggest environmental surveillance projects in the world, covering about 11 million people. Next slide, please. This is just to tell you that our data is on a dashboard, which is publicly available. It's on Twitter, it's on LinkedIn, and basically this is the viral loads of COVID since 2021. Next slide, please. Next slide. I mean, this is click. I think I made a mistake with the animations. Next, keep clicking. Again, circled over here is one more group called IDRF. One of the greatest things that we have been able to do with Bangalore, next slide, is work very closely with the municipal government. And one of the pictures that you saw were actually sense-making meetings that we had with the COVID war room in the city at all times. In November 2022, the Indian Alliance for Public Health Preparedness was officially launched, as we have already talked about, so I'm not going to go into that. Next slide. All the key learnings and the SOPs, the protocols to initiate a citywide surveillance have been made publicly available in this playbook, and this is basically what was used to a great extent in expanding the environmental surveillance to a larger number of cities. Next slide, please. So what have we learned so far? Wastewater is a great way to track community burden of disease, not just for COVID, but also for influenza and for antimicrobial resistance. We also tried it with monkeypox, but Bangalore never had a case of monkeypox, so we don't actually know what happened over there. But we will believe that this can also be used as Mr. Praveen talked about for typhoid, other gastrointestinal infections, and other upper respiratory tract infections. It can also be used for veterinary infections, such as foot and mouth disease and other diseases that may not infect humans, but do cause massive economic losses to the country as a whole. Next slide, please. These are basically data from TIGS, which is another group in the coalition. Next slide. Click. Our data suggests that regular, widespread, frequent, and longitudinal, and this is the critical part, longitudinal aspect, because for most environmental surveillance programs across the world, funding is a problem. And if surveillance happens to be cross-sectional rather than longitudinal, you really are not going to be able to make use of the data that comes out. So longitudinal information is what helps you figure out whether there's an outbreak or whether this is just background noise. Next slide. And what we've seen is that wastewater can be a fairly useful way by which genomic variants of infections can be found. This in COVID, we were able to see variants of COVID in the wastewater earlier than what was seen in clinical samples. However, the problem with COVID is that you don't actually know the clinical significance of variants until much later. However, this has been found to be very useful, for example, during polio. When New York had the polio outbreak very recently in 2022, they were able to figure out whether it was a vaccine-derived polio virus variant or a wild-type infectious variant fairly soon, and were able to control that outbreak very quickly. Next slide, please. Next slide. So as I talked about before, a lot of groups were involved in COVID environmental surveillance and sense making of that data within the context of the clinical picture. This is just to tell you how complicated it can get, even for a single disease like COVID. And this also tells you that the players who are there in COVID may not be the same for every other disease. So this context kind of tends to vary. Next slide. This is what we did. We used the same platform for antimicrobial resistance screening. These are basically in little brown circles are the open drains at which water was sampled for antimicrobial resistance to look at hyperlocal variations in antimicrobial resistance, because as you can imagine, that will change by the local antibiotic prescribing patterns. And in the little red pluses, those are basically proximity of these sites to tertiary care hospitals. And we do notice that there is a difference in the antimicrobial resistance, both by zone as well as by proximity to hospitals. Next slide. This data is basically site-wise, species-wise, antibiotic-wise distribution of AMR across Bangalore city. There is massive variation. Again, indicating that there are hyperlocal variations. There also might be illegal dumping of antibiotics into sewers across the city. Let's move on. Next slide. And as you can imagine, basically the coalitions would be changing. Next slide. Next slide. And the next. And there's massive interconnections between them. Next slide. I'm just going to go really fast over the next few things because I know I'm already out of time. Next one. Next. Next. Why does this matter? The thing about AMR matters because when you dump things into your wastewater, this wastewater doesn't just stay in Bangalore, it goes to places outside of Bangalore. In 2017, the Karnataka government started an experiment, a very large-scale experiment, the second largest kind of its world, where treated wastewater from Bangalore is pumped to areas around Bangalore. And so when they use this water for rejuvenation of their lake and their groundwater, and then this is then used for aquaculture or agriculture, a lot of the stuff that is there in the wastewater may actually be getting pumped to outside areas as well. And this, as you can imagine, could have health risks, not only for humans, but also for animals and for plants. Next slide, please. Next slide. So this is actually one of the impact of this program called the Sanjeevani program. In 2018, on the left, as you can see, extremely dry, extremely drought-stricken, massive shortages of water, and also a huge risk to food security. And this is the same area in 2022, much greener, much more widespread usage of agricultural land, and a lot more productivity. Next slide, please. Next. So what did we see? What we've seen is that the Sanjeevani project, where you actually are pumping out Bangalore's wastewater, increases groundwater levels, increases agricultural and land productivity and net income. This actually has a huge impact on equity, because people are no longer having to move from one place to another to find jobs and to find for their livelihoods. And we are hoping to see. Hoping to study the impact of this Sanjeevani project on the health equity of the people who are directly impacted by it. Next slide. As you can imagine, lack of water forces abandonment of farms, closure of water-dependent industries, loss of food security, descent into poverty, and therefore measurements of ground-level changes to health equity because of this massive project are really required and are we are hoping to start those off. Next slide. And that's it. I'm not going to talk about these concluding remarks. I think I've talked enough about that. So let's move on. Thank you so much for your patience, and apologies again for any delays.
No worries. Thank you so much, Dr. Varsha. Thank you for sharing a substantial amount of work in very short, brief period amount of time. Next, I'd like to invite Dr. Rezaul Hassan, who is the Deputy Project Coordinator for the Program on Emerging Infection at the International Center for Diarrheal Disease Research in Bangladesh, ICDDR. So over the past 17 years, Dr. Hassan has had extensive experience working with projects in health systems with a focus on national scale up. This has required long-term liaisoning with government policymakers, health managers, UN organizations, development partners, and NGOs. He has also worked on multi-sectoral community engagement interventions for environmental surveillance for infectious diseases. With that, I invite Dr. Hassan to come and share about the work that's been going on in Bangladesh.
Welcome and good afternoon all. So thank you for providing the opportunity to share the Bangladesh experience in this forum. I would like to convey my gratitude for that. So I am Dr. Reza. On behalf of Environmental Intervention Unit of ICDDRB, I have been working on environmental surveillance initiative in Bangladesh. And the study is implemented with technical support from the Center for Global Safe Water, Sanitation and Hygiene, Emory University, USA, and under the stewardship of a government surveillance lead Institute of Epidemiology, Disease Control and Research, IDCR, with funding support from the Rockefeller Foundation. Next slide, please. Environmental intervention is a long history of our team. We conducted one of the largest randomized control trial in wash and nutrition research. The unique findings of lead adulteration in turmeric was brought to light by our group, which influenced the country policy. The group also, with diverse expertise, working on the environmental contaminants, air pollution, climate change impacts on human health. So initiation of our wastewater-based research started from 2017 with the Sanipat trial and explored fecal contaminations in different environmental contaminants. During the period of 2018 and 19, another study confirmed environmental exposure pathways for high concentrations of pathogens. And first year in Bangladesh, wastewater-based epidemiological surveillance for SARS-CoV-2 started in 2020 by our group at the high peak of fear and anxiety of COVID pandemic. Next slide, please. So, after the successful implementation of the wastewater-based epidemiological surveillance in Bangladesh in 2020, the potential of SARS-CoV-2 environmental surveillance paved the pathways for surveillance of other endemic pathogens and vaccine-preventable enteric pathogens, Vibrio cholera, Salmonella typhi, rotavirus, and SARS-CoV-2 environmental surveillance initiative started to design and execute within existing health system. The ultimate goal for this research is to create a platform of rapid response for pandemic potential pathogens as well. And we are implementing the environmental surveillance research in capital of Bangladesh, Dhaka, and the largest refugee camps in the longest sea beach, Cox's Bazar. Systemic sampling strategy, quantification of selected pathogens through molecular approach, monitoring spatial and temporal trend to establish a dissemination platform for communicating and supporting decision-making process through government health systems are three main objectives of this research. Next slide, please. So the Dhaka, I think hopefully you are all aware about this mega city Dhaka, and I think like other big cities of India have similar experience on sanitation and sewerage management. So complex and mixed sewerage and non-sewerage sanitation is the characteristics of Dhaka, and direct environmental exposure of fecal excreta to drain and sanitation network is common, with only 20% area covered with the sewerage network. And clinical surveillance of COVID and endemic diseases have some limitations, and we had the evidence of high fecal contamination in low income, high income, and urban slant area. Next slide, please. And you know that we are hosting almost 1 million Rohingya refugees since 2017, and they are living in 34 distinct crowded environments that is called the camps with limitations of sanitation coverage. Diarrhea, SARS-CoV-2 outbreak threats very common there, and outbreaks of cholera happened almost 2 times in each year. You may be aware that wastewater surveillance of enteric disease and SARS-CoV-2 have not been explored in any refugee settings in the world. Next slide, please. So this project is implemented in close collaboration and coordination among ICDDRB, the Emory University, and the IDCR. ICDDRB is the key implementation partners and coordinating among collaborators, and key technical support providing by the Emory University, and stewardship and guidance by the IDCR under the Ministry of Health and Family Welfare. Next slide, please. This is a very complex project, and we are also collaborating with Communicable Disease Control Program of Director General of Health Services of Bangladesh, who is the lead of Communicable Disease Program implementation in Bangladesh with Authority of Vaccine Campaign. If you just go back that we are targeting the 4 vaccine preventable diseases, environmental surveillance. And Dhaka North City Corporation is the responsible for sanitation network management in Dhaka, whereas Dhaka Water and Sewerage Authority is responsible for sewerage management. Similarly, in Cox's Bazar, we are collaborating and implementing the project with the Office of the Civil Surgeon, Cox's Bazar, and then the Refugee Relief and Practitioner Commissioners, and also the Department of Public Health Engineer, the engineering groups to support this research. And obviously, for this humanitarian setting implementation, health sector and wash sector are very close partners, which are led by the WHO and UNICEF. And we are also collaborating with the IOM, UNHCR, and UNICEF to implement this research in the humanitarian settings. Next slide, please. So, just the unique experience, our project, especially our implementation of environmental surveillance, this represents the larger population and the geography, able to address the complex sanitation system and the government ownership and engaging them for further scaling up the commitment. That is very important and excellent outcome till implementation till to date. And obviously, implementation in humanitarian settings and outcome could be very important to develop a strategy to other humanitarian settings scale up. Next slide, please. I don't want to share the detailed result. As you know, many things about the impact and outcome of the environmental surveillance. Rather, I want to only focus to prove again that environmental surveillance has the potential to supplement the clinical surveillance. But the main focus for these 4 pathogens that different pathogens have different dynamics in the environment and the wastewater. You may find that the percentage of positiveness is not similar for all pathogens. Next slide, please. We are implementing the environmental surveillance since February 2023, and by December 2022, we are able to develop the sampling strategy, standard operating procedure through process of stakeholder engagement, transit work, scoping visit, and formal launching of environmental surveillance with high-level government officials and donors in August 2022. From initiation to implementation, especially for the major overview and milestones, seems to be very simple, but we want to confirm you that complexity for implementation of the environmental surveillance within the existing health system is not visible here. This is truly a good opportunity, and I think it can be Bangladesh experience could be a good role model to implement in other Southeast Asia and other countries. Next slide, please. So this is the social impact and the dissemination of our information, especially what are the positive impact from our environmental surveillance to the global community. The Economist also features our study in the environmental surveillance, and the ICT review also have the huge impact. And lastly, from the wastewater monitoring was highly impacted in the global community. Next slide, please. So now I want to share the challenges, especially from the non-sewerage area, especially for the low resource setting, but low income. The identified sampling points are the major options, but a major barrier for identifying the sampling points, and the catchment area and size, so which is overcome in the Cox's Bazar, but we are still finding, facing some problems to identify in the Dhaka. And you know, the maps, resolution maps and water flow upstream and downstream area, we still have some struggle, especially in the Dhaka. And now we are in this stage, we are trying to impact for the climate sensitive disease. You know, among 4 diseases, especially the cholera and the rotavirus and the salmonella typhi have the climate effects, especially they are the disease dynamicity change due to temperature and humidity change. So now we are also incorporating those variables, climate change variables for analysis of our data. And most importantly, the disease prevalence, especially the clinical data, that is very much important to correlate and make some assumption. We are facing some problems for this type of clinical data availability through from the government system. Next slide, please. So what we are hoping in coming days, that distill and synthesize lesson and recommendation developed from our implementation evidence and the clinical data on disease prevalence. We are already in a state to sharing of the data from the government as well as the WHO, who is the mainly the leading the humanitarian settings, and they agreed to provide the clinical data sharing with our team. And national coordination and liaison with Minister of Health, donor, and DPs. This is in progress, and in coming days we can see some measured outcomes. And national preparedness for environmental surveillance scale up. IETC also already agreed, and now we are very much hoping that in coming years we will be able to develop the national capacity development and national guidelines for implementation of the environmental surveillance in coming days. Next. So. We'd like to thank all of our collaborators and partners supporting ICT before implement environmental surveillance research in Bangladesh. Thank you all.
Thank you, Dr. Hassan. Just a quick announcement that we will be running 15 minutes over time at the end of the call for those who can stay on for the panel conversation. With that understanding of the broader landscape of the work that we're working within, I'm going to invite Dr. Pooja Agrawal, who is a consultant with Crypto Relief Fund and a member of the Indian Alliance for Public Health Preparedness. She has extensive research experience in molecular biology and genomics, together with an in-depth understanding of regulatory and clinical frameworks. Her interests lie in translational research and in its utility for in the public health sector. So, Dr. Pooja, I'll pass over the panel discussion to be moderated by you. Thank you.
Thank you, Alicia, and thank you to the speakers. Am I audible? Yeah. Perfect. Thank you for the great session. Just a few points. I mean, a lot of learning, a lot of in line with what Indian Alliance for Public Health Preparedness is planning to do. But I had a lot of key takeaways, how information integration is important, what is the cost benefit per person, eventually if you do environmental surveillance versus not. What Dr. Varsha said, and very, very important, how longitudinal data collection is key. You cannot have snapshot, but you need to have longitudinal data collection, and how it's interesting to see how these surveillances and technologies can play into health equity. And a great examples from what has been done in Bangladesh. And we see that there are challenges that we all face, and we face here and other places, with great model and the effort being done internationally. So with that, I just had a question for speaker, and I would like to start off with Praveen. So we saw that PATH has been engaged, you've been engaged with surveillance, before pandemic, and then continued the work, and in various regions across South Asia. So how is the uptake of environmental surveillance at scale varying across countries? What have been some of the factors for this, if you can help us with that?
Great. Thanks, Dr. Pooja, for this question. And this is very important from the stakeholders' point of view on the uptake of ES. So if you know, conventionally, the wastewater surveillance started with polio, and that to be largely with the National Polio Surveillance Program. But then that has not picked up to that extent where it could have been in a continuous system. But gradually, when the pandemic hit, that's where I think everyone has thought of doing a continuous surveillance. And then to some extent, there were some ES-based surveillance for typhoid being attempted in few parts of the country. But I think ever since now, many cities started trying out the COVID surveillance. And then in the month of February 2023, there was a circular issued by the ministry to do a wastewater surveillance for COVID-19 and tracking the variant of concern in wastewater. So that also gives us an idea of to what extent Ministry of Health is now thinking about using the infrastructure which has been made available during the pandemic, and how even the district health facilities, the block health facilities under the investment made by PM Abhin, the Ayushman Bharat Health Infrastructure Mission, is also a way to demonstrate that how these infrastructure, which is likely to be upgraded, will go work in collaboration with these genomic sequencing labs, which are not just at the Apex lab, the central government lab. There are academic institutions, there are state government owned medical colleges, and even some public health facilities and the state government setup. So I think these are all some of the factors which has really helped India to lead the surveillance part and the environmental surveillance. And I think you may have also seen in my presentation that how we are even trying to leverage these investments made by government. And of course, there the focus was largely to look at the diagnostics, but also how do we even plug these environmental surveillance into their system, so that the bottom-up approach is very essential. Otherwise, generally you see largely the surveillances have been carried out by majorly the premium institutions like ICMR or many other academic institutions, but then the participations from these lower facilities were very minimal, and those were very project and site specific. But then this setup, what we showed in the picture, is something which is applicable pan-India, and it could potentially even be done in various other parts of the world also. So that's something which I felt is the best way to answer to your question. Thanks.
Thank you. So engaging with the local labs and building infrastructure to help together be part of the surveillance. And how does this span across any experiences you may have with the other countries in South Asia? How, taking India as one of the examples. Yeah.
So Nepal, how we did the environmental surveillance for pandemic, but now gradually what we are also trying to do is how the same infrastructure which is being set up for pandemic in Nepal can be used for say various other diseases which are very endemic to the Nepal, and also AMR. Again, everyone knows AMR is one of the biggest threats to the global, to the mankind, and also these transboundary diseases, generally these animal infections which are leading to all these sort of endemic or pandemics, and that's where very essential, where you use this environmental the One Health circle also, where I was focusing on the intersection. So I think doing an environmental surveillance of those intersection is also going to be a key to identify any sort of threat which could be unknown today, but then the data, as and when it is emerging, will give you a alarm to the stakeholders that this is something which is potentially coming up all of a sudden, and then they should try focusing at their level on, and also reach out to the international stakeholders to provide some sort of assistance to look at what could be the possible threats, or how could we even develop something at a policy level so that these things can be monitored continuously and controlled over a period of time to avoid any sort of localized or even various other neighboring countries spillover. So that's again something which is we anticipate to do it in Nepal.
Sure. Thank you, Praveen. Dr. Varsha, as I said, I do think that integration and expanding to, everybody got excited about COVID surveillance, and I think surveillance really came to limelight with the pandemic. So environmental infrastructure that was built during COVID pandemic, how can we apply to other monitoring systems, Dr. Varsha? If this question is for you, and what do you think could be some of the challenges that could arise?
Yeah, hi, thank you so much for that question. I think, as I said, also in my talk,
sorry, your voice is a little choppy.
hardware. It's the software of environmental. Are you able to hear me?
No, we lost you
Is my voice
again
now?
for some time. Now it's clear. Yes,
It's back though, yeah.
yeah.
Okay, so I was going to say that more than the hardware of environmental surveillance infrastructure, it's the software that is actually much more challenging. And this basically
Dr. Varsha, we're not being able to hear you
means
clearly.
the relationship building, things like that, which I think, because what makes a particular kind of sense to administrators or to journalists. And okay, should I maybe come back to this in a little bit?
Sure.
I will type
Yeah.
my answer. You can.
It is clear now. Yeah.
It's clear again, yeah. I'm wondering if you can put your response in the chat maybe, and then Dr. Pooja, you can read it out for us. Yeah.
Yeah, sure.
Thank you.
Sure. So we can till then move on, and I do have a question for Dr. Hassan. And thank you, Dr. Hassan, for showing the extreme amount of effort that's gone into working out the surveillance in Bangladesh. So what has been the key ingredients or key points in advocacy strategy for environmental surveillance in Bangladesh that has led to this successful project and collaboration between various sectors to make it successful?
Thank you. Just I want to echo first with Mr. Pravin that environmental surveillance is a One Health approach. The disease, this is mainly handled by the health department, but the advocacy is truly with other collaborative approach, especially for the multi-sectoral engagement. I think the government, obviously the Ministry of Health is the main lead, and they will collaborate or implement the environmental surveillance. But you see that from the engineers, from the Department of Public Health Engineering, who are responsible for sanitation network developments, and also for the others, especially for the Dhaka Sewerage and Water and Sewerage Authority. They're also maintaining the other collaborators. So multi-sectoral approach is the main advocacy point I would refer for success of this environmental surveillance for scaling up. And another thing is that the data is very much important, what Dr. Prakash said. He was focused in the laboratory data, and we want to focus on the clinical and environmental data correlation. Especially the availability of the disease-specific data. Dr. Prakash was much experienced with the polio and other disease surveillance for environment. But actually, this type of environmental surveillance, even for the antimicrobial resistance, the disease and clinical data that we need to be the sources and the mainstreaming. We need to have focus for that specific gun. So I think overall through advocacy that government buy-in. And another problem is that the funding. We sometimes mentioned that environmental surveillance is a low-cost intervention, but how much low compared to the clinical surveillance? How that will supplement and with the funding modality with the funding constraint. And I think the most important thing is the long-term commitment from the donors and also from the governments for providing support for scaling up the environmental surveillance initiative. It is not possible to get some result within 1 or 2 years. It will take some time. So I think that is very much important. Thank you.
Sure, thank you, thank you. So that's a note for us. Yes, funding is critical, and sustained funding, definitely. And seeing ways how we can have low-cost implementation or tools, as some of the points that Praveen also touched upon. But the key essence being the multi-sector interaction, collaborations of various sectors, which is what I think Dr. Varsha has been citing, that what we can take away from SARS-CoV surveillance is these networks that we have built, this understanding, and the importance that we have shown that this kind of surveillance can bring to community health. I do have, if there are any other questions from the audience, Alethea, by any?
Nothing to bring in, Pooja. They've been responded in the chat.
Sure, perfect. So just a final question for each panelist. Wanted to have your last take. We do have 5 minutes left. So again, everybody has already chimed in that cross-disciplinary partnership and collaboration is important. What can we do to further enhance this, and how can this then take to climate-related health crisis that we may foresee in future? It is important, and how can we sustain this is what, so while pandemic was the need of the hour and we all came together, how can these collaborations be maintained over time and look for other surveillance, be it AMR, be it polio, be it other communicable diseases that may threaten communities, which may be different for different areas. But so Praveen, do you want to start off?
Yeah, thanks, Dr. Pooja, again, and this is pretty much very interesting questions to answer. So again, I think recently there was one publication from Dr. Madhukar Pai from McGill University, where he did mention about the engineers being the unsung heroes for public health program. Because while at first glance we think public health program is all about the doctors, the nurses, the epidemiologists, the patients, and of course, microbiologists like me also feels that the public health is all about only between the doctors and the patients. But again, addressing the complex challenges like climate change and human health require a multidisciplinary team. And I think this is where, of course, the traditional experts are also, of course, needed. But then we also need specialized architects, engineers, health informatics, experts in technology, zoologists, agriculturists, and all various stakeholders who are essential in today's scenario where we need to work in collaboration and not to work in silos. And how do we expect the health sectors to cut down its carbon footprints? That is also pretty much important today. And there are multiple pathways through which the climate change impacts the health. And of course, extreme weather events prediction plays a vital role in reducing deaths due to heat wave, cold waves, and of course, cyclone. And spillover of infection from animals may bring in the next pandemic sooner than we even think. So I think climate change is a public health emergency, and I think it's important to have this multidisciplinary collaboration between all the experts to think and work together and face the challenge and overcome it. That is more challenging phase. So I think now is the time where we need to work in collaboration with all these people, the experts whom I have named. So with that, I think over.
Thank you. Thank you. Dr. Varsha, any thoughts to that?
Maybe Dr. Varsha's connection isn't the best.
No, I think he captured it really well, Mr. Pradeep. Thank you.
Sure, thank you. I think, yeah, the connection is still thinking, but we did get your message that Praveen has captured, and you've already
add one thing. I don't know how many of you have watched.
I think, Dr. Varsha, your internet connection is still choppy.
But there is
Dr. Hassan, may I request?
Sure. Thank you. Just I want to say in one sentence, the sharing, the learning, that is one important aspect from this environmental surveillance. We have the different dynamics, but cross-disciplinary approach, even the molecular lab, then the epidemiologist, we are in the engineers, and then the decision makers and policy makers. So whatever who working on this, they need some evidence, they need some results. They want to see what we can, especially the policymakers says, so what we want to do, what you want from us. We want to provide some kind of clear evidence to them, and the learning from India and learning from the South Asia and the sharing and the multidisciplinary, especially we are collaborating with the Bangladesh Meteorological Department for climate change data. And how can we engage here? So whatever the stakeholders or the departments, we need close collaboration with evidence, the informations. So sharing the information is very much important, I think.
Thank you.
Thank you
That's a really good note to do that evidence-based information to convince different sectors to come together and collaborate, something that Precision Health has been doing through collecting data from different cities. Great sessions. I don't have anything to add. That really summed it very well. And thank you for your discussion. Over to you, Alicia.
Thank you, Dr. Pooja, and thank you for this session. With that, as we wrap up, I'm going to invite my colleague Rohan to also just share some final thoughts and summarize some of the conversation that we've been having today and how we are imagining this work can move forward. Rohan, we are not able to hear your audio. I can give you a minute. But since Rohan and I are colleagues and we work in the same space, I'm going to go and sit by Rohan really quickly so he can have access to the audio.
Hi, everyone. We're sorry about that. But yeah, I think firstly, huge gratitude to all the panelists as well as Dr. Pooja for just so crisply summarizing this. I think the key challenges that lie ahead of us have been things that were brought to the fore from the pandemic itself. We've all sort of lived through the past 2.5 years with this shared sort of sense of vulnerability, but also a commitment towards public health. The pandemic experience has also taught us that there have been ways in which, if there is urgency and if there is a sense of need, like we all come together beyond, our sectoral and geographical boundaries, and then work towards solutions. And I think as we set up the alliance and continue these conversations, we hope that we're able to strengthen and build on some of these conversations already. What we've heard already about One Health, and particularly around the need for this intersectoral collaboration is things that are values that as the alliance we want to carry forward. So we'd love for you to join hands with us, reach out to us, see more information that's already on your screens. And we hope to be in touch with you all. And as Dr. Reza said, really, we want to create a space for more sharing and learning so we can strengthen the way we think about health for all. Yeah. Thank you. Thank you, everyone, for your time. Have a good afternoon. We'll be in touch.
Thank you.
Thanks, everyone. Bye.
Thank you very much, and bye.
Bye-bye.
Thank you very much. Bye-bye. Bye.